Time now is 7:20. For patients who need palliative care in the final days of their lives, the option to be cared for and die at home isn't something that's always available.
Yes, a new survey suggests that one of the main barriers is a shortage of specialists who can also offer the right training to family members. Breakfast's Graham Satchell reports.
My husband Roger, I've been married for 47 years and he was RAF aircrew, brave man. 13 years ago he was diagnosed with cancer. When his condition was terminal, the only thing he wanted to do was to die in his own house with his own things and me looking after him.
Okay, so we'll practice with some water. So we'll just draw up a mill of water.
Zilla took part in a trial project. With the help of a district nurse, she was trained to give controlled doses of pain relief to her husband at home.
How easy did you find this process?
Yes, it was easy for me with your adequate instruction.
Zilla didn't have to actually inject the pain relief into her husband's arm. A thin tube or cannula was already in place and the dosage was closely controlled. It allowed Zilla to relieve her husband's pain in his dying days without relying on a nurse who could be several hours away.
This was such a godsend to me to be able to do that. It took away all the hopeless, helpless feeling you have to see someone you've loved for so long in pain, and it was wonderful.
It's so important for people to have the death that they want, where they want it to be. It has a lasting effect on the family that they leave behind. And I think that if that family can see that they died peacefully and pain-free at home where they wanted to be, then that's the overriding factor. And we just secured that then.
According to the National Council for Palliative Care, most people would prefer to die at home. But a survey today of 370 healthcare professionals suggests for many it's not happening. More than a third of nurses and GPs who support dying people at home say staffing levels are not sufficient to meet pain management needs. 20% said their caseload was not manageable, and nearly a third said the availability of end-of-life care training in their area was inadequate.
Our study shows that we are really failing people who want to spend their final days and weeks at home. We know that pain is people's greatest fear, and if it's not controlled, that will lead to emergency admissions to hospital and bad memories for the families who are going to live on.
The Department of Health in England says everyone should be involved as much as they want in plans around their death. Having family members administer pain relief won't be for everyone, but it is becoming one option in the final days of life.
It certainly gave me such a feeling that I'd been here to the end with Roger and made his last days completely pain-free. And he died with me and both his sons here, holding his hand just as he would have wanted.
That was Graham Satchell reporting there. And to talk about this now, we're joined by the Director of Policy and External Affairs at the National Council for Palliative Care, Simon Chapman. Morning to you, Simon.
Morning.
Thank you very much indeed for coming in. We saw Zilla's story there, and she spoke so movingly about the help she was able to give to her husband in the final days. But that's an unusual case, isn't it? That's not seen very much as yet.
It's unusual at the moment, but we need to see more of it because actually most of us want to die at home. It's where we find familiarity, privacy, peace, and actually our relatives, our friends, our families want to be able to look after us in relation to that. And we're never going to have enough workforce in the professional health and social care staff to help in relation to that. You know, of course, having more specialists is going to be really important, but actually we need to think about what we ask those specialists to do and training and supporting carers so that they could administer pain relief so that somebody isn't waiting, sometimes actually with the drugs in the house, for 3 or 4 hours for a nurse to come up and administer it when they could do it themselves
in considerable
easily,
distress.
as we've seen. Yeah, really distressing to witness somebody in pain and you could do something about it but you haven't been trained to do it.
So, I mean, yes, you imagine those scenarios and how agonising that would be for both parties, for everyone involved. But that's happening because people don't have the confidence, they haven't been given the skills to give that treatment to their loved one. Is that what's happened?
It's about giving them the skills and us as a society giving people permission to do it, really. So
permission, but that's permission that's not in a technical and legal sense.
If you like, it's a moral permission in relation to it, because we've tended to rely too much on a professional model in terms of supporting people to die at home. And actually what we need to do is to really support and empower communities, neighbours, family, friends, carers to provide the care that they want to do, if they want to do it.
Because that's quite an important point, isn't it? If they want to do it, I can imagine for some people it would be incredibly difficult to do, because in the final days of someone's life, if you're administering pain medication, as much as you want them to be out of pain, it can be incredibly dangerous, can't it? Because you could potentially hasten their death.
Not actually if you've been properly supported and monitored and trained. So the difference required between the amount of medication to deaden pain and to kill somebody is actually quite high in those circumstances, because you build up a tolerance to morphine the longer you're on it.
So, Simon, who gets this right? Where do we look for a model of how to handle this incredibly sensitive subject that works?
So we are seeing this being tried in adult palliative care, for example in Lincolnshire. That's one of the places we saw, and we know that it happens in places in London and elsewhere. But actually also in children's palliative care, we know that parents are already administering medicines and providing lots of care and support to their terminally ill children, and this is something that the adult sector can learn from as well.
So what is the situation now then, in places where this is not happening? How does it work? If you're looking after somebody at home who is in distress, what do you do? How do you ramp it up and say, you know, this person needs extra help now? Who do you call? What happens? Sometimes
that can be really, really difficult, and the default often is that actually people will end up calling out the ambulance service or take people into hospital. So adding...
Which is the opposite of what
absolutely,
you want.
adding stress to an already stressed system. And actually this is about taking some of the stress off the NHS, but it requires us to think differently about how we ask healthcare staff to support, to coach, to mentor the carers in relation to this.
And if someone is, you know, there'll be people watching this now, you know, who have a family member, they might have been through it in the past, or it's an ongoing situation. What's the advice? It's something you touched on there, but who do they talk to? Who do they turn to for advice?
At the moment, again, that will depend about the country. Sometimes they will turn to their GP, sometimes they might turn to a hospice, sometimes there will be a care coordination service in relation to this. But actually, in this sort of circumstance, particularly when you want to care for somebody at home, start by talking to whoever the healthcare team, the people in charge of the person's care are, and saying, this is something I might be interested in doing.
Thank you so much for talking to us. It's a very interesting subject, and I should say as well, thank you to Zilla, who you saw talking about her situation, her husband Rogers. So it makes such a difference hearing those personal stories, because it brings it right home.
Thank you very much. Thank you.
It is 20